Today there is a moment where you will make a profound impact on another's life. You may not realize it, but you've done it. Everything you've gained, everything you've accomplished, pales in comparison to the impact you make through that moment. Today, there is a moment. You have a responsibility for patience, for each other, for your community. There's a moment. Today, there is a moment.
Years ago, I had a young child come in from a car wreck with parents as well. I was called to the emergency room to collect some samples and such. Found myself alone with the child, 7 or 8-year-old boy, and I just sat there for a few minutes and told him everything's okay. You know, just kind of sat with him and seemed to calm him down. The nurses came right in, doctors came right in after me, but it seemed to really help just to take a moment of my time just to let this little boy know that everything's going to be okay. Mom and Dad are okay, and people are coming to help you, and everything's going to be okay.
We got a phone call back in February 3rd of 2015, and my wife had called me at work, told me that I need to get up here, that they were doing a bone marrow on my daughter. And I got up here, and long story short, she has ALL. Watching our daughter go through cancer, and you know, she got married in August of 2015, about 7 months later, and to walk her down the aisle, that was a pretty cool deal.
I look over and I see that there's still a little girl in the car. She's probably 4 years old. So I go over and get the little girl, and she just puts her head against my chest, and she's just crying, and she keeps asking me if Mommy's going to wake up and be okay. And it was just heartbreaking. And it just made me realize that sometimes our jobs have nothing to do with what our name tags say. Sometimes our jobs are just to talk with people and to comfort people. And that night, my job had nothing to do with X-ray, but it had to do with making that little girl feel comforted so her dad can take care of the situation that he needed to take care of.
One of my co-workers, her husband was having surgery, and she was really concerned. He went through his surgery fine. They got good news that they were not expecting. I came into work one day, and there was a basket of flowers on my desk. And she came in and told me with tears in her eyes that I don't know how much it meant to her that I gave the words to her that her husband would be taken care of by Cabell Huntington Hospital.
You all don't know what you have here. This is a gem because the services here are excellent. Everyone lets you feel their warmth and caring. We're just very pleased.
We kind of just thought it was a bruise or something that just didn't go away, so we went to the doctor and they took x-rays, and then they told us just to come back and then or go back home. And when we pulled in the driveway, they called my mom and told us we needed to come back now. So we went back, and then they just told us it was cancer. I remember the nurses would always bring in games and stuff for me to play with when I was bored. I always remember just having the most fun time in here, even though it was a hospital.
I was able to go into one particular patient's home, care for him for over a year. We became friends. The gentleman was very ill. His family cared for him greatly, and as the gentleman passed, I was asked that very morning if I would be able to speak at his funeral. I took great pride in that. It was an absolute honor.
There was this patient who has a history of Parkinson's, and he's had a really bad tremor in both hands for the past few years. And the tremor is that bad that he can hardly drink from a cup of coffee, he can hardly eat his food without needing assistance. So we tried a whole bunch of medications, it didn't really work out for him, and then we decided to pursue what is called as deep brain stimulation. So we did a surgical treatment for Parkinson's disease. And I saw him in the clinic after the surgery was done, and his tremor basically disappeared. He has no tremor now, and he's now able to eat and drink. He can do all his daily activities that he needs to do by himself. I wanted to make a difference to these people's lives. So when I heard her saying that it was such a big thing for him as well as her, I mean, it's a tremendous feeling to hear that from your patients and their families, that they're so happy with your care.
When I first met Dr. McGinnis, she gave me lots of choices. And when I made my decision, she told me, I think you made the right decision. And I had confidence. I just felt like I was with the right person in the right hands. And everyone here, through the entire process, has been wonderful to me. And that makes a big difference.
It's Vickie's journey, and I'm along the way to help her and help her be a survivor.
And in that 30 minutes, she and I just got to sit and talk, and we got to get heart to heart. And she was telling me all of her concerns and her fears. And every time that she came in, I got to be with her. And through the course of her medical procedures, we became very close friends. And even when I see her out and about today, we give each other hugs and we catch up. And it's nice to know that I can make a difference for someone as much as they can for me.
And let them know that, we've all been places we shouldn't have been, done things we shouldn't have done, and it's okay. It's where you're going from here that matters. And then once you can build that bridge and be able to deal with mommy, and then you can help her baby.
Cabell Huntington Hospital is special because everybody here is so great. They'll either help you out or lead you to where you need to go, get you what you need to do to make your job better, or so forth. I mean, everybody here is just so wonderful. I can't ask for a better hospital.
It was definitely scary bringing a baby into the world, let alone two preemie babies, is a really scary thing. And right from the get-go, from delivery to the moment they took him to NICU, there was peace of mind. I was like, oh my goodness, this is like their baby. They're treating them like they're their own babies.
Cabell Huntington personnel saved my life. They seemed to know exactly what to do, how to do it, and above everything else was the comfort they gave to me by their behavior toward me and toward each other.
Well, I work in the NICU. I've been in the NICU for a long time. So I deal with parents, and I realize that they probably have a lot of fear, and I try to be understanding of that. But when you're on the other side of it, that fear is realized, and you turn to the people that you've worked hard to be. And so those people were right there for us and treated us exactly how I would want to be treated.
And when you have troubled families or hurting families and they're able to come together and reconnect, again, there is nothing more exciting than that. And those are the moments that we live for at the Counseling Center.
My experience at Cabell, here giving birth to Maxwell, has just been wonderful, or was a wonderful experience. From the day that we got here, even though we knew we were coming, I was very anxious. As a medical professional, I thought I knew what to expect, but I had no idea. And everybody from housekeeping staff to the patient care representatives, my nurses and the lactation consultants made this experience wonderful for me. I think at a time that's so exciting, you're looking forward to everything being very positive, but at the same time, you're not really ready to feel vulnerable. And I think that the staff's, compassion, paired with their competence, really made me feel comfortable throughout the entire process.
Whenever we had multiple trauma patients that would come through our door, when we had many people that were sick and ill and probably wasn't going to make it, we all really band together really well. And many other places that I've been throughout the state and throughout the area just wasn't that same way.
Today there is a moment. We're all on a separate journey. But today, we're together right here. In these halls, in these rooms, with the sole purpose of improving another's life. There's a moment when you'll struggle, when you'll cry, when you'll anger. That moment is yours. Your path is a choice. You choose it. You create it. When that moment happens, there may not be an audience, an award, or applause, but it happened. Our souls hunger for achievement, for accomplishment, for impact. Our patients hunger for our passion in the care we deliver. They hunger for that moment. Deliver it.